Well, good afternoon, everyone, and welcome to our chamber webinar this week that we are doing regarding the Omicron variant and COVID in the workplace. We have with us today the Executive Director of the Green River District Health Department, Clay Horton, and the Chief Medical Officer from Owensboro Health, Dr. Michael Kelly. Welcome, guys. Good to see you today.
Hi, how are you?
Thank
So,
you.
yes, so Clay, I thought we'd go ahead and start off with just a brief update on where we are community-wide with Omicron, the variant and the spread.
Sure, I'd be happy to do that. And I think I should be able to share my screen here if I can. After a couple of years of doing Zooms, hopefully I know how to navigate this now. But just in terms of and if Candace, if first of all, thank you for giving us the opportunity to kind of talk with your members about this again. And then if I've had a couple of different things I wanted to talk about, but if you want to just kind of talk about a little bit where we are with Omicron to start with, and then I don't have to go through my entire 50 slide deck here that I have.
Yeah.
No, I only have
just a brief update would be good. And we have around 15 questions that have already been submitted. So
okay.
In the meantime, participants can also continue to ask questions that I will receive. And if they're not duplicate, we'll put it at the bottom and we'll ask those questions as well. So yeah, you can just kick off with just a brief update on where we are.
Sure. So with Omicron and with COVID-19, I mean, we are just seeing an absolute tsunami of cases in our community, and that's not unique to us. We're seeing that, across the rest of the state, and we're seeing that in the country and the world as well. So this is an epidemic curve, and I'm not going to go into a whole lot of detail here, but there's three things that are being shown here, and these are all new cases of COVID-19 by population. The blue bars in the background is the state rate, that is for Kentucky. The red line is Davis County. And the green line is the Green River District Health Department. And a couple of things I'll just kind of point out to you here. We think about ourselves a lot of times being in a smaller community, that we're isolated from what's going on. The things that we see and hear that are related to COVID-19. I think people have a tendency to sometimes think that, oh, that's happening somewhere else, that's not happening to us. But if you can see, there are times, through this journey where we've been above the state average. There's been times where we've been below the state average, but in general, we're following the same pattern. So what is applicable for everywhere else is just as applicable it is to us. But then the other thing I want to point out is just what our experiences has been and where we are now. If you look over here on the far left side of this epi curve, you can see just this, just a little bit of white between the state rate and our local rates. This is when we had 2 or 3 big major employers in our region where we had very significant outbreaks early on in COVID-19, and we thought here at the health department that it could not get any worse than that. We thought that we were completely buried. It was the worst thing we'd ever seen in terms of infectious disease outbreaks, and just there's no way we could keep up with it. And then we had our initial surge through the winter of 2020. A little dip right after Thanksgiving when we closed down a lot of places in Kentucky, when we had very strict community mitigation measures. And then, as we came through the spring, vaccines rolling out, we saw this come way down. And then we had this Delta surge starting back in late summer. And, that's, where we really saw a lot of strain on our healthcare resources in our community, saw a lot of strain really on everyone. That got better. And then here we are today with Omicron. And as you can see, the peak that we are heading towards with Omicron dwarfs anything that we've been through before. And that's kind of where we are. Dr. Kelly can probably talk to this. We're hearing a lot in the media about Omicron being a less severe form of the disease. That very much can be true. But we are just seeing tremendous amounts of illness, lots of exposures in our community right now. And I think it's going to put a strain on everyone, not only our healthcare system, but businesses, families. And that's why we appreciate the opportunity to talk with you all and answer some questions.
I could add, a little bit to that, and we don't want to necessarily go out of order here. We can do it however you want. But, for me, if the denominator is as high as it is when you look at that peak, so you have the total number of people that are infected, even if it is less virulent but more contagious, which I think has been proven in South Africa, the UK, and in every other place that has published their data and already had it come through. then you are still at risk for being overwhelmed by the number of cases. There's a little bit of a feeling here, and I can't say that it's played out like this quite yet, but that we will have more patients with that less virulence because of vaccination, other things that will be admitted to the hospital or seek ED care, but less overall percentage admissions, maybe not total admissions, and maybe more floor patients that have shorter lengths of stay rather than people that progress to critical care level or intubation or death. Now, there's probably some pebble of truth in there. We're kind of seeing that to some degree, but I do worry about the total number of infections. And for our case here at the hospital, we break a record every day with the number of positive tests that we have. So the last data I have in front of me was from the 10th. It was 794 positive tests. That's just our tests that OHRH runs through our drive-through. So we run PCR-based testing, 2 runs per day, and the max capacity that we have that we always say we would never have a problem with is 760 tests per day. So now we have to staff up in a critical staffing shortage, additional run of tests to be able to meet the demand. So those are the type of signals, the drive-through traffic with symptoms, the number of positive tests, the percentage positive tests on us are anywhere from 30 to 60%. So of all those tests that I just talked about, 30 to 60% of them are positive, as opposed to when we used to look at these and we would have, some much smaller percentage of people that came through that would end up becoming positive results. So that's exactly kind of what Clay's describing in a more global sense or a more statewide sense or Green River District sense. And we're seeing that, drill down to us.
I'm going to probably go through the questions that we've had submitted, if you all don't mind, since there are so many. And let's see, first of all, are meetings in person advisable at this time?
Well, I mean, I think you're going to have to make judgment calls on more factors than just blanket or all meetings advisable in person or not. I think the size of the meeting, who is vaccinated, what is this, what are other kind of mitigating factors you have in place? Do people wear masks? I can tell you here at the health department, we are having very few in-person meetings, if at all. You may have some very small groups. We are still requiring masks to be worn in all of our facilities. But for the next couple of weeks, I think that I would be pulling out all of the stops in terms of putting precautions in place and trying to protect the health of my workforce and keeping them where they can come back to work.
From our perspective, we have so many people who are traveling all the time that are involved in our committees, and we have found that virtual meetings, even for this time being for the next few weeks, it doesn't really it doesn't hurt the plan of work, doesn't hurt what we're doing if we're meeting virtually. It just sometimes can help more people be there. And we have so many people now in quarantine and in isolation, those folks can participate in the meetings, instead of just missing the meeting altogether. So, we've moved most of our meetings virtually for a while. Rooster Booster was in person last week, but we didn't serve food at the event. We served it after, but, we are doing our best to help people not be exposed, if they haven't already been exposed. We just don't want them to feel obligated to come and then have to call them with oh, sorry, there was a positive result in the room.
Absolutely.
So,
the vast majority of hospital meetings are virtual. We will try to find, if we need to have something in person for certain committees that are peer review or protected data or other things that we feel like it's going to be important, or looking at pathology or deciding on cases that we need to meet sort of in person. We make sure that we're appropriately able to be, have some distance amongst each other, get a larger room, but the vast majority are WebEx based at this point.
Thank you. So this person asked, will we follow the same guidelines as last season for COVID precautions during this season? I'm not quite sure what that's supposed to mean. I'll try to figure that out, and we'll hop on to the next.
I'm sorry. I can try to take a stab at that if if we can. I mean, I think that we've learned a lot over our experience with COVID-19, but in terms of your precautions that you want to take, I mean, I think the big ones are very obvious. First of all, encouraging anyone who's eligible to be vaccinated to get vaccinated. Everybody above the age of 5 at this point is there's a vaccine available to them. If you've already been fully vaccinated and you're eligible for a booster, which would be, folks that are 2 months past getting a Johnson & Johnson vaccine or 5 months past receiving one of the Moderna or Pfizer vaccines, run out and get a booster today. Vaccines are plentiful within our community, and that's going to be your best protection, not only against infection, but the severe consequences of COVID-19. And we can talk about that a little bit more. Masks are very, very effective if they're worn consistently and correctly in slowing the spread of COVID-19. So that's one that we've talked about a lot. It's one that has fallen out of favor. It's one that there's a lot of bad information out there. I'm reading, people that are misinterpreting or selectively interpreting things that are talking about, cloth masks aren't as effective. They're especially not as effective as a virus as contagious as the Omicron variant. But that's not to say that no masks are effective. So if you're wanting to take precautions, you're wanting to protect your workforce, you're wanting to protect those around you and yourself. If you're in public or if you're in settings with lots of people, wearing a well-fitted mask is something that we've been talking about for a long time. It's something we talked about with previous surges that's still very applicable and something that still needs to be done. And then, the other one is if you're sick, stay away from other people. And then, you want to have kind of given the benefit of the doubt towards caution with employees that may be sick. You don't want them coming in and contaminating the rest of your workforce. So if someone's symptomatic, somebody has a positive test, those are the things that I would really think that are going to give you the most bang for your buck in terms of safety practices for navigating these next several weeks.
Thank you. So we have a lot of employers that we represent at the chamber who do in-home work. We have contractors, plumbers, construction people. There's just a lot of things that people require in their homes. And we're seeing a lot more work done right now. There's a boom almost in that area. So do you have any advice for business owners who are going into homes and working to keep their employees safe?
Well, other than the ones I just mentioned, again, getting their employees vaccinated, wearing a well-fitted mask, ventilation is a big key. So, keeping space between, if you're having to go into a home, keeping some space, between the residents of the home and their employees, and keep, propping open a door or cracking a window, making sure you have good airflow. I think all of those would be good practices and will lead to the protection of their employees.
Yeah, and also it's incumbent on the homeowners too to let people know. We had that situation last week where we had an active case in our household, and you have to do the right thing and let those people know that they can't. You don't want to endanger someone that's coming trying to improve your quality of life, right?
Right. And that's a good point too. You could add a screening question. Somebody calls for a service call. You could ask that question: is anyone in the home symptomatic for COVID-19 or been exposed to someone that is or had a positive test in the last 2 weeks? I think that's all legitimate, and that's all things that will lead to taking care of employees.
So how many cases do you all estimate, I guess percentage wise, that are being underreported since so many of us are doing at-home tests now?
Well, in terms of infectious disease surveillance, we know that our laboratory confirmed cases are always just the tip of the iceberg, and so we know that cases are way underreported. I think with the availability of at-home tests, that's even going to be more so. I've seen estimates as high as 5 to 10 times are the number of actual infections in a community versus what we're actually seeing. But to directly answer the question with Omicron, with what we've been experiencing the last 2 weeks, I don't know that we have a very accurate estimate at this point. We just know it's a lot more than what we've actually are able to see with our surveillance. And what we're able to see with our surveillance right now is dwarfing everything that we've seen before. So it really does speak to how contagious this virus is and how quickly it is spreading through the community.
So our companies, I'll answer this question, but do you all know, as far as if someone gets a positive result, So they require a five-day quarantine. Is that correct? Or until there's no symptoms after the 5 days? Is that, Mike?
Yeah, so I mean that's difficult to navigate, but I think I can take that. So we all know that a week and a half ago, CDC released the shortened isolation and quarantine procedures, and let me, if I can, I've got a little bit more detailed information on that I'll try to share with you. But there were a couple of things going on. So first of all, the science was kind of being sorted out with Omicron and how it may be a little different than previous variants that we've seen. And then the other thing the CDC was really looking at was in revising their guidance was, what is going to be publicly accepted? How do we continue to reduce risk? We're at a point now with COVID-19 and especially with Omicron that containing it is absolutely impossible. So what can we put in place that's going to reduce the number of infections and give good guidance, good instruction so that people can make these types of decisions? And what is the societal impact? I mean, we were looking at a scenario where people would not have enough employees to operate and keep essential services functioning. So and then along with that, the science kind of bore out that the infectiveness for what they were finding with Omicron appeared to be highest in the 1 to 2 days prior to symptoms onset and the first few days of symptoms. The majority of the transmission that we think was happening in the community was happening at the beginning of the infection. We do know that there's going to be prolonged shedding of the virus. We know that PCR tests, for example, will continue to test positive on some individuals for some time, even after they've recovered. It's not thought that type of viral shedding is effective or even viable, but there is some limited risk there. And then we also know that people that are immunocompromised or people that have been, had severe disease tend to stay infectious for longer periods of time. So CDC kind of came out and said that with Omicron, that it could be reasonable to shorten that isolation period and that quarantine period with some individuals. And so what was publicized and what made the headlines is that CDC reduced the amount of isolation from 10 days to 5 days. But there's a lot of nuance and detail to that didn't get picked up in the headline. I would have preferred it if they had said something along the lines of, it's a 5+5 strategy. So, if you test positive and you haven't had any symptoms ever, I think you can count on a 5-day isolation before you can come back to work, with the understanding that when you come back to work, you need to be wearing a well-fitted mask for 5 additional days at least. If you had symptoms and you test positive, I think in my mind, I would be counting on doing a 10-day isolation for most people. But however, if your symptoms resolve, you're feeling better, that can be shortened down to as little as 5 days if you're able and willing to wear a well-fitted mask for the balance of those 10 days. And then in terms of quarantine, when we talk about isolation, we're talking about people that are infected, that have tested positive. Quarantine are those folks that have been exposed to someone that are infected, but that are not showing any symptoms. We've talked a little bit about vaccination. So if you are up to date on your vaccines, your COVID-19 vaccines, you're fully vaccinated, you had a booster, you're exposed to someone with COVID-19, we're not directing anyone in that situation to quarantine. You should wear a well-fitted mask for 10 days. You should self-observe for symptoms for that period of time. We would recommend, if you can, to get tested 5 days after that exposure. But those individuals, if your employees are fully vaccinated, they're up to date on their boosters, they're not going to have to quarantine because of an exposure. They can continue to work as long as they are healthy. For those individuals that are not up to date, we would say they should quarantine for 10 days. After day 5, if they test negative, they continue to be asymptomatic, they can return to work. So the key things there, though, is that mask wearing is critical to this strategy. The strategy won't be successful if we don't incorporate mask into it. And this is guidance for the general population, for healthcare workers, nursing homes, congregate settings like homeless shelters, jails. We have different strategies, but for the general public, this is probably a pretty good way to navigate these next few weeks where we know we're going to have tons of infection, but we still need to try to keep society going.
So,
Thanks,
so
Clay.
our piece in the hospital or for the healthcare workers, if you use that same framework, the biggest difference for us is for the longest time, we always said we would not, if you were COVID positive and known, even if you were asymptomatic, mildly symptomatic, and you were one of our team members, you would not be working. But given many things, including the staffing challenges and the changes in the epidemiology associated with Omicron, what we've done now is that 5 days, we do not at 5 days necessarily require another test for the asymptomatic to minimally symptomatic people to come back and work. We're always masked in here for the most part, other than certain times when we're by ourselves. But if we're in direct patient care settings, we're masked or we're N95 and all those pieces. So we do have, in order to be able to take care of people, have to have people back now at day 5. This goes from a conventional strategy to now a contingency strategy. If we were to get to the crisis strategy, which is the concern, then if you are positive on day 0, on day 1, on day whatever, you are working. If you are asymptomatic, the minimally symptomatic. And the minimally symptomatic piece of this is you can feel like you've got kind of a bad flu, but if you're functional, you need to come in. If you don't have an oxygen requirement, signs of an infection on an X-ray, pneumonia, that's moderate disease. So we're talking about all hands on deck if we get to that crisis strategy, and we're already in that conventional strategy now to be able to try to maintain safe operation.
Thank you. And that was actually a question that was submitted. So thank you very much for that. Okay. Are companies requiring employees to use their personal vacation time for leave on this? We're hearing a lot of different approaches depending on what employer this is, and they may have different ways of looking at this if an employee is vaccinated versus unvaccinated. But that's really not I don't think that Dr. Kelly or Clay would really know about that specifically. That would be something that you would have to ask your colleagues in business about, other employers, or you and I can have that discussion one-on-one after the webinar. Let's see, please explain. We did that one. Okay. So as far as the spikes coming next, I mean, we've seen this time and time again with the new variant and new spikes. I know you all can't predict what's going to happen, but do you think this is when we're getting to the endemic stage in the next couple of months?
I mean, I guess that's all the hope that we want to have about this, and that, something so transmissible that it can spread like this, that people will have both B cell and T cell immunity built up. And to speak to a little bit of the spikes that Clay had shown, there's some thought that this is an ice pick kind of spike, and all these other ones were more of a hill or a hump, right? And so that is the hope, and that we go way up and we come down relatively quickly. And in the setting of that sort of tsunami or whatever we want to call it, that, we have a nice lull like we did between phase, 2 and 3. And then I think we'll find out. I don't have a great prognostication here. I can read literature from people that I follow that I think are, sort of thought leaders on this on the medical side, and I can get 50-50 splits on that. But I think if we want to take an optimistic thought or approach to this, that maybe on the tail end of this, with the vaccinations, with the natural immunities, with the fact that this has outcompeted Delta, which was a more virulent variant, that we could look at something that would be more endemic. And just for the audience purpose, something that is just part of the fabric of us, but is not spiking all the time. We just have some seasonal bumps on the road here and there, and we're in general not dealing with these large onslaughts.
Good deal. Clay, anything to add?
No, I agree with all of that. I think that we hear those type of questions a lot, and the thing that I always try to say is, that will be a very interesting story one day. But for right now, really a lot of our role is just to try to get through this, and listening to the best strategies from that are being put out by CDC, other healthcare organizations, they're really your best bet in terms of being successful here. And so, we are hopeful. And I've been watching other parts of the country that seem to take off a couple of weeks before we did, and to see what happens with them. Some of those areas are starting to flatten out a little bit, not really coming down. But I think from the looking at the timing of where where it started earlier in other parts of the country, we're not done yet. We can expect, at least in the short term, to continue to see these numbers go up.
Thank you. So a person had asked on what's the protocol if you've been exposed, and I feel like that slide and the third layer said what you should do if you were unvaccinated. So say you're fully vaccinated and you've been exposed you were exposed at a meeting. So what do you do the next day?
If you're up to date on your COVID-19 vaccines, meaning you've had a booster, if you're eligible for one, or you've been recently have become fully vaccinated, and you're feeling fine, just making sure that you're being careful around others. You're wearing a well-fitted mask when you're around other people. I think is the most that we're asking of you to, if you know someone who's particularly vulnerable, someone who's immunocompromised, you want to be, especially careful around that individual. But in general, if you're fully vaccinated, you're boosted, you're wearing a mask around other people, that's the most that's being asked. Other than maybe taking a test after day 5, I think I would suggest that. It's for those that are not fully protected, that we would say you need to stay home for at least 5 days, monitor for symptoms, and then get tested. And then even then, for the another 5 days or so, wearing a well-fitted mask when you're out in public, and make sure that you're taking those steps to protect other people.
So as far as a 4th booster, do we see that coming soon? There are a lot of people who had their boosters back in, gosh, I mean, it was way back in the fall that the first round of boosters started. So, and a lot of those were people who were elderly or had immunocompromised situations. So what do you all think as far as the 4th booster is concerned? Dr. Kelly, are we hearing anything?
So I kind of have a smirk. I don't know if people see that or not, but it's one of these things that, not to be flippant about it. And, I think first and foremost, the people who haven't been boosted need to get boosted. I know it's a little bit, but it's, let's say that 70%, and then we see about 35% got boosted. And so we have all those at-risk individuals that haven't been boosted on top of that. I feel like I tend to follow Israeli data because they've had, sort of an early on piece. They were very much all about Pfizer. They tend to publish. They were able to follow their population very well. I look at the UK piece and all that. I expect that we will have some sort of yearly thing. I don't know about the booster frequency and all that at this time. I mean, we talked about this a lot at the beginning. This isn't like getting your Hep A series or your Hep B series, or it's not that type of virus. It's I'm not calling it the flu, but it is similar functionality to that type of thing. So I feel like it's going to be a yearly thing at some point, and I think that the technology will catch up in the types of shots that we're getting, that we won't need them every 6 months or so. But right now, that's where we're at. So I'm skirting it a little bit, but I wouldn't be surprised to see it tomorrow morning in the news. So somewhere, somehow, somebody's saying it.
Thank you. And that was well said. So we have I know a lot of people who had 2 shots and they didn't get a booster because they didn't want to get the side effects. And then they got COVID. So a lot of those people were pretty sick. And but now they're wanting to get a booster so they can, because they probably had Delta, and now they're wanting to make sure that they're at least protected with Omicron, so it'll be mild. Yeah. How long do you have to wait between that COVID window that you had COVID where you could get your booster?
I'll give Clay. Go ahead, Clay.
Yeah. So unless you had received like the monoclonal antibody infusion or treatment, as long as you've recovered and you're no longer in isolation and you're feeling okay, you can get the booster. There's not necessarily a waiting period after infection. If you did take one of those more advanced treatments, you would certainly need to be screened, but in general, for most of those individuals, it's a 90-day wait after if you took
For
that
the ones
treatment.
that received the monoclonal
That's
infusion.
Antibody treatment, yes. So if you didn't have that treatment and you're feeling okay, you can go out to any pharmacy, health department, doctor's office, whoever is offering the vaccine, and they will ask you about your history, but you will not be deferred for that reason.
Good deal.
And I think this goes back to the very beginning of it all, when we were telling people that had it, that they should wait 90 days.
Mhm.
And that was a scarcity issue. That was because we did not have enough vaccinations to meet the demand. So that messaging has kind of bled through over the last 2 years about it, but you do not have to wait. And strangely enough, and it is 90 days, but in reality, just to throw this in there about monoclonals in essence are giving you immunity, right? You're getting antibodies, monoclonal antibody infusion, and they really only last for about 30 days. So I know we say 90 days and that's the rule right now, but you are not in a protected phase in theory from monoclonals for up to that 90 days, but that's what's currently out there and what's recommended. So if you were to get it at 88 days, we're not going to like pull punch it. We're going to, it's not a hard and fast, but that's kind of what's out there.
Gotcha. Great. Thank you. So a lot of you all had asked about the Supreme Court and when we expected for them to come out with a ruling. Actually, right before we started our webinar, they came out with their ruling and they are rejecting the mandate, but not on CMS, which is medical related agencies, organizations that get Medicare or Medicaid. That ruling did hold up, but the other did not for 100 people with 100 plus employees. So the vaccine mandate and the testing mandate really did not pass the Supreme Court, but it did for people that operate medical related that get Medicare or Medicaid. So that's to answer that question. Are there any other questions? I don't see any more coming through from our attendees. I think we've answered all the questions that have been submitted. There was one very specific question, and when someone wanted to know if a person can get COVID again a month later after testing positive. Is it more likely that they're testing positive again because they had the virus a month early? In this example, they did show symptoms both times.
There's a lot of different scenarios here. These get into the one-off situations.
Yeah.
So I'll give you for example, although it may be a little too. So Clay had mentioned that PCR testing, particular testing, can remain persistently positive for quite a while.
Mm-hmm.
So when you get tested with a PCR, which is what we use at the hospital, we've seen people 45, 70, days out still remain positive. And the question always comes up, is this just the PCR and is this just viral shedding of dead virus that's not infectious, or is this a reinfection? And it's really hard to tease out sometimes based upon the symptoms and other pieces. What we do is we try to do our best clinical judgment on that. Did somebody have recovery? The other thing that happens is they test positive, but this is a consequence of having had COVID previously. So we'll see people who've had COVID, recovered, come back, still are COVID positive, but they have a bacterial pneumonia or some superimposed problem that gets maybe lumped together as COVID, but it's really a consequence of how sick they were before, or some superimposed thing on there, and they're sort of incidentally COVID positive. So I know that gets a little more complicated into how we do those, but we see those all the time with people saying, is this a repeat COVID infection? And so we'll tease that out one by one and decide, hey, wow, no, they grew blood in their bacteria in their blood. This is a separate superimposed process, and that test probably isn't infectious. And a lot of times we have to place people in isolation until we sort that out here. So it's hard to know. Everybody's story is a little different on that. For us here, but we do see people get reinfected, although I would think it would be a little less likely to be a reinfection within such a short time window.
Okay, thank you. Thank you so much. So that concludes our questions and concludes the webinar. We will have the charts that Clay showed you, particularly the one with the guidelines on quarantines and who needs to do what on our website. I believe it may already be there, but we'll have it on our website if you want to go back and refer to that. And in the meantime, Clay and Dr. Kelly, thank you both so much for your time. We appreciate everything you're doing, and also just the healthcare workers in general that you all work with every day. We appreciate it deeply.
My pleasure. Thank you.
Yeah, thanks for the opportunity to talk again.
Thank you all.